Since the COVID-19 pandemic hit the world almost 2 years ago, health experts have been revising and relaxing the standard operating procedures in managing the disease. Initially, an infected person with mild symptoms was required to isolate for at least 14 days until they were revised to 10 days. Now, the Centers for Disease Control, the American-based organization, has recommended a reduction requiring an infected person to isolate from 10 days to 5. According to the CDC, the decision is based on research about when people are most infectious. Dr. Misach Wayengera is the chairperson of the National Task Force on COVID-19. Dr. Wayengera concurs with CDC.
So we kept testing people on day 7, on day 10, on day 12, and it was generally agreed that day 10 made a representative day for testing people, especially those in the hospital, towards negativity, because so many tests were being wasted in the process.
Dr. Wayengera says the guidance by CDC was informed by science after findings confirmed that one can be less infectious after 5 days.
If somebody tested positive between 7 and 10 days when they got exposed, it means that if you give those people another 5 days, their viremia will start to go down. So the CDC probably looking at this and the potential impact, let's say, on somebody like you who has to work. You begin looking around what is the best option. When the viremia falls below a certain threshold, people cease to transmit.
This new revelation, according to CDC, was driven by the demand and time spent in isolation, making them less productive.
I'll give you an example. Let's say I got infected as a doctor and you need me in the hospital. How long would you allow me to be out of the hospital, given the fact that I need to go back to work and serve other people? So the whole issue is zeroing in more and more on the time when the person is most likely to transmit. So this applied from the public point of view is good in the sense that you're getting an average, but you will still have those persistent shaders who might escape this period.
Dr. Wayengera says Uganda is studying the CDC findings with a view to domesticating the recommendation in the near future.
And if somebody is better and they can return to work within the period of 5 days, and the evidence shows that there is a lower risk for transmission, then well and good. We probably will adopt a similar path. But that will depend on the evidence that we accrue from this.
This information comes at a time when the president is expected to make a national address on COVID-19, with many expecting further reopening of the economy. Dr. Wayengera has cautioned the public about the rising infections in the country.
From what we are learning with COVID, the vaccines do not prevent primary infection and transmission. As a result, even if you're vaccinated, you need to wear a mask. We suspect that by the time we are entering the new year, we probably will be hitting 2,000 cases.
By yesterday, Uganda had registered 135,998 cases since the pandemic started. Jingo Francis, NTV.